Dr. Mugdha Raut.
I am Dr. Mohan Raut.
Welcome to the fifth episode of our series Coping with Infertility, titled Communicating with Your Partner on Maintaining a Strong Relationship During Infertility. We at Dr. Raut Center for Reproductive Immunology treat couples with unexplained IVF failures, repeated miscarriages, and unexplained infertility with the help of active immunomodulation in the form of our patented and branded Immunology. Seeking hope and emotional resilience becomes essential. Understanding this struggle is the key to providing compassionate care and support. Hence, we are planning this live series every Wednesday on how to navigate this journey with the help of a passionate mental health advisor, Dr. Akshata Bhat. Welcome, Dr. Akshata.
Hi, namaste.
Dr. Akshata Bhat, a consultant psychiatrist in Vile-Parle East, has extensive experience across public and private sectors. She specializes in treating mood disorders, schizophrenia, and substance abuse while actively promoting mental health through workshops as well as social media. Dr. Bhatt is passionate about raising awareness and ensuring mental health, especially in couples with reproductive failures. Today is the fifth episode of our series. You can see the first 4 episodes in our YouTube channel, Dr. Raut's Center for Reproductive Immunology. Please don't forget to like, share, and subscribe our channel also. Knowingly and unknowingly, you may help a couple complete their dream of becoming a family and having their own child.
So now we are over to Dr. Akshata Bhat. Dr. Akshata, we as I said, we as gynecologists, we see the deep pain in the couples, what they are going through. We see sometimes husband is not coming, sometimes only the wife is coming. These things are, we know something is playing on the couple.
Absolutely. I think what you're saying, Dr. Mugdha, is absolutely right. Because whenever we treat a couple with infertility, we always tell them, it is not your individual person's problem. Infertility pertains to a couple always. So then therefore, both of you have to be investigated, both of you have to be treated simultaneously, only then you will achieve success. So here, there is one more point which is we feel very relevant here, and that is the communication between the partners or between the spouses. So, Dr. Akshata, why do you think this open communication between partners is so crucial while dealing with the problem of infertility?
Infertility is a sensitive subject. I think for you all, you have been working in this field for years. You know how difficult it is for people to talk about it. And although in the last few years, the attitude about it has changed, I think given that we are in a patriarchal society and everything, that the expectation is you get married, you have children, and the most common tendency is to blame the woman in case they are not able to have children. And what Sir said is absolutely right, that when you talk to the couple, you have to explain that this is a couple issue. It's not his or her fault. It is a couple issue that needs to be tackled together at a biological level, and these are things that people are not generally aware of. So it's very easy to point fingers or to place blame on somebody and say that he or she is the reason why they don't have kids. Now, coming to communication, because it's a sensitive topic, because there is a little bit of stigma still attached to it, people are very hesitant to talk about it. Someone who is sensitive to their partner's needs may also feel that if I bring it up, I may hurt his or her feelings. They may feel that I'm attacking them. You may be actually bringing it up as a source of concern. It may not be that you're doing it to lock horns with your partner. This is something that is genuinely bothering you, but it may be perceived as a personal insult or a slight. This is why communication has to be better. You can communicate the same thing in a clearer way and show what your intentions are instead of letting the other person assume or come to any conclusion. Also, what I want to point out is in this situation, they're already under a lot of stress. And we all know that when we are under stress, it is very easy to misunderstand things. The most common thing we've seen in day-to-day life is getting annoyed with somebody because you have taken something out of context. They may have said something in a different way, but because I was in a bad mood, नहीं ये तो मेरे को ही बता रही है. They are saying this to me only. They are criticizing me. They are making fun of me. We tend to pick up on it, being more oversensitive in this situation. So we have to be mindful that both of them are already stressed out. Both of them are already quite exhausted with this. When will this happen for us? That unanswered question looming in the background. Plus, families are always there to add spice to everything. So it is important to have a good communication between the two of them to reduce friction, to reduce misunderstandings and arguments.
I think this communication is the key, I think.
So, Dr. Akshata, when you said about misunderstandings and frictions, are there any more challenges which the couple face apart from this misunderstandings and frictions when they are struggling with infertility communication?
Yeah, it's very common to feel a lot of anger, to feel a lot of guilt, to feel a lot of frustration that this is not happening. Sometimes you may feel that I cannot verbalize this in front of my partner because they will get affected by it. People who are mindful of this generally tend to keep things to themselves. Now, while that is the intention is good that you're trying to spare the other person's feelings, for you, it may not be healthy in the long run to store so much of emotion. You need an outlet. Everyone needs an outlet to express themselves. Irrespective of which side you are on, you deserve to have a space where you can talk about things. And if it is not with your spouse, you should have a friend, a family member, ideally, to help you support through all this. And if none of that is an option, or if you don't feel comfortable talking to them, talk to a professional. Find a healthy outlet for everything you are going through, because you're going through a whole different array of emotions. Couples who have been through repeated miscarriages, for them, every time there is a miscarriage, the trauma is like losing a child. We discussed this in the previous sessions that everyone's perception to a miscarriage is different. Some people will see it as the loss of an actual baby. Some people may see it as that this didn't work out this time, but we can do it again. So we cannot expect everyone to have a very, very open idea about this. Everyone is going to react in their own ways. So we have to understand that there may be anger, sadness, guilt, depression, frustration, anger at each other that maybe you are not trying hard enough, you don't want this is why it is not happening. Anger at the circumstances, anger at the family, all of these things are possible.
Yeah, this is very commonly encountered. What we saw about anger about the other partner.
Absolutely.
Because there are many issues which come up which were not there before, and then blaming each other worsens the situation. So I think these are the main hurdles, I think, in the communication that the couple is facing.
And they have to understand that this is real. Communication issues are real, and they should address it rather than just blaming each other over. Because I very well remember we had a patient, and the fight went to such a high, escalated to a degree where the staff came to tell me that they are accusing each other and abusing and talking these things.
Mm-hmm.
So when I went to them, I said, see, you are taking treatment currently. I can understand your emotions, but don't say things which probably you will regret later on. And it so happened that they said sorry to me. They said, yeah, we understand that. And they said sorry. And the same cycle, they conceived a successful pregnancy. And this now, when this meet us, they still joke about it. Yeah, that time the communication was so poor, and we did work on it. And now they have 2 children. She's conceived a second time also successfully. So I still remember that particular day when someone had to make them realize that there is a problem. This is a very important point which you brought across, that communication and feelings are real and communication issues are real.
Right. And these hurdles, what you mentioned, they really impact the communication. So, Doctor, you want to say something?
Yeah, I wanted to say that sometimes we underestimate how much damage our words can do. What you said, no? That first we say something and then we say sorry for it, but the damage is done. And just telling the other person, sorry, bol diya na, abhi to chhod, move to the next thing. I think it's very difficult for the other person. And one thing we can also try, all of us as people, also be very mindful of what you say when you say it. In a fit of anger, it is very common. We've all done this at some point, that we said something very nasty, something insensitive, something that will hurt the other person. And generally, when it is a couple, you know each other well enough to know how to harass the other person. You know how to make them happy, but you also know how to make them miserable. You know how to say that one thing that is going to make them cry you know so what I'm trying to say is, don't use this against them in an argument. Don't go to that. For a lot of people, they do that because for them this is war, everything is fair, we can go to any extent. But our words do a lot of damage and we have to be very careful how we use them. A common example here, like a parallel I can draw here, is when I'm talking to parents of young children. I always tell them, please be very careful in how you talk to the child. I have heard and seen some very horrible things, where very young children are verbally or even physically abused by their parents, for small things, for seemingly trivial things, for being mischievous, which is what children do. And the thing is, when you talk to adults, some of them will tell you things from their childhood, and they will say that when I was 5, my mother said this to me, or my father hit me, and I still carry that pain today. What I want to point out is the damage that our words do can take a lifetime for somebody to get over, or maybe they will never get over it. So let's be very mindful in how we talk to each other. Let's be very kind when we talk to each other.
So, right, that's where I was coming to, that these hurdles in communication, they are there. So, how can couples support each other emotionally in this journey with proper communication? Means, can you suggest how can they help each other or support each other from the communication point of view?
Because it becomes an additional stress factor for them. A reproductive failure becomes an additional stress factor.
Because maybe each one has different coping mechanisms. So,
as a couple, what can they do together?
So what Sir said, now everyone has a different way of coping with the situation. For some people, when something happens, if there is an argument or a disagreement, they want it to be resolved immediately. Some people would want that let's take some time away from each other, let's take a break, and then we'll come back to this later. Let me cool down, give me some time to cool down, figure out what my emotions are, and then we'll come back to this. So now here, imagine if you have two people with such differing ways of dealing with conflict, it's going to be difficult. So, what we have to do is find a middle ground. For a couple like this, what I would have suggested is maybe you can discuss this later, but within a specific time frame. It should not be that baad mein baat karenge becomes not today, not tomorrow, keeps getting postponed. You stick to a time frame. You say that, okay, we are not having this conversation right now, but I will talk to you in the evening about this at this time. This is a helpful way. This is a middle ground between both styles. This is the example I'm trying to give here. So, in such a situation, always find a middle ground. You're not always going to get everything you want in the relationship. Everything is not going to go your way. And everything cannot go your partner's way also. It's not fair to the other person. So find a middle ground, find a common space where both of you can get a little bit and give up a little bit. That way there is balance. Every relationship balance is very important. You cannot have one person doing all the work or giving in to every situation, saying yes, okay, whatever you say, I'll do it. That's not healthy for anybody in this equation. So finding a balance is very important in these kind of things. If you have different ways of dealing with things, find a middle ground so that both of you can come to some sort of understanding together.
So, are there any strategies which are there in dealing with such misunderstandings or the miscommunications?
So one thing I always tell people now, when things get very heated, try to take a break, because what happens is the more heated it gets, the more it's going to escalate, which means that it may have started about something else. It is reaching somewhere else. It may have started, तुमने towel यहाँ पे क्यों फेंका, but it will end up with तुम्हारी माँ ऐसे बोलती है मुझे. What I'm trying to say is, instead of letting it escalate from here to here, let's break it down somewhere here. Take a break. When things get heated, take a break. But tell each other, let's take a break. Maybe spend some time away from each other to cool off, to figure things out. Put a pause button. Sometimes, a very nice technique I've heard of people saying when they have a fight, they tell each other, we'll put a pause right now and then come back to this later, not as chalo jhagda वापस करते हैं, but let us resolve what the conflict was. See, when we get angry, emotions get out of the way. We tend to say and do things that we would not do otherwise. And we may say something or do something that will hurt the other person. So rather than that, take a step back, take a break, go out, take a walk. One of the best things I tell people is when you get into an argument, please go out and take a walk separately, sit in separate rooms, have a glass of water and breathe in one place. Sit quietly for 5 minutes, drink a glass of water and breathe. The point here is you are breaking the chain of conflict over here. Even if it is temporary, it helps. Rather than the next 5 minutes, which should have gotten more heated and more gali to other family members would have happened. Let's stop it here. Come back to this later. Second thing, find a common ground. Like I said, if you have different ways of dealing with conflict, find a common ground. Have a strategy in place for when you are arguing. This might sound a little funny, but having this helps, knowing that, okay, I know I'm going to lose my temper now, so better for me to find a way to deal with it. For a lot of people, the parallel here I'll draw is for a lot of people, I tell them that you should have a way to deal with a stressful day. End of a day, what do you do to relieve your stress? Is it a cup of tea, or is it, a skincare routine or exercise? Have something in place that you are comfortable with. So here I'll say the same thing. Plan for it. Understand that fights are inevitable. Jhagda hone wala hai. How you resolve it is more important. Don't It's only in movies that they show couples don't fight and they live happily ever after and they share one blanket when they're sleeping. Real life mein aisa nahi hota hai. Everybody knows that. So be realistic about the relationship. Be very, very realistic that both of you are humans with your own moods, with your own emotions, with the way you perceive things is going to be different.
So yes, this communication gap, as you have said, these techniques will definitely help. But sometimes, in spite of this, in these patients with infertility or miscarriages, they have a strong feeling of guilt, or you can say a blame, like blaming ourselves or blaming oneself. So how can they, what could you suggest to them to get over this problem? So how can they help each other to get over this problem? Because both of them might be facing the same emotion.
So, one thing I keep saying consistently is that taking on the responsibility of someone else is difficult, unless you are doing a very, very good job for yourself and you are very healthy and sorted, it's very difficult to take on somebody else's burden. I also feel that should not become a habit for anybody, taking on the burden of someone else consistently. It has to be shared because then it puts too much pressure on one person. You cannot expect to do everything for everybody at all times. You have to be able to do things for yourself. Now, coming back to what you said, I think guilt and shame are very, very, very powerful and difficult emotions for all of us to deal with, And if it is not possible for the partner to help, at least don't add to it, If you cannot reduce it, don't add to it. Don't make it worse. If you know your partner is already feeling sad and angry and frustrated and blaming themselves or feeling very guilty or shameful, don't add to it by saying mean things or behaving in a bad way. If you cannot help, at least don't harm, Guilt and shame specifically, I would think it would be better to talk to a professional about it because these are very complex emotions. They tend to be rooted in a lot of other things. It's not as simple as today I'm upset, so I'm feeling guilty or shameful. It's generally very, very deep rooted, It can be an indication of past traumas that they've been through or them going through repeated trauma in their life, which is why this is coming up. So this I would want a professional to address it.
And especially because it's not a sprint, like you've always mentioned in the previous episodes, not a sprint, it's a marathon. So this guilt and shame could be even carried forward throughout their journey. So I think here a professional help is extremely important. Now, as you said, like, you set boundaries or you set timings. Now, do you think it's helpful for couples to set boundaries when they are discussing infertility? Because here it becomes a joint issue. And, they are like the timing, the frequency, and other things like what we discussed before. How would it apply to infertility for a couple? Like they may be going to a doctor together, coming back together, and then that's when they probably there is a blast. So, what do you think? Does it make sense to set a boundary at that point?
So I think the important thing is to go for all the visits together as a couple, not expect only one person to go or to go separately. Maybe going individually and then going together also may be helpful, but definitely try to go for most of the visits together because both of you and your concerns can be addressed. Second thing, take professional help in this case. Talking to doctors like you and Dr. Raut, that would be the sensible thing to do here rather than rely on information from friends or from family who may be well meaning but they are not professionals, they are not dealing with this. You have to talk to an expert in this situation. Or Google bhai to hai, Google bhai se kuch pucho mat. Google bhai will give you a lot of information but it is not knowledge. Okay, so no googling, no asking family members, get all your doubts cleared by the professionals. Now, coming to the second part about having a difficult conversation and setting boundaries. Get into the habit of having difficult conversations early on in any relationship, irrespective what it may be, because the things that we avoid become the things that come to bite us later, in a very silly way, if I'm putting it. Whatever we tend to avoid, it's going to come and get us at some point. You can't avoid these things. You may not want to talk about the infertility journey today, but you will be forced to in a couple of months when things are not going well. The point I'm trying to make here is don't avoid difficult conversations. Get into the habit of having them. But since you also should take your partner's mental health into account and their state of mind, do it at a point that both of you are comfortable. Also be able to tell your partner, this is where setting boundaries comes in, where you can tell your partner that I'm not in the right space of mind to have this discussion right now. Can we schedule it for later? Now here again the point is later means you're not postponing it like indefinitely. You are going to bring this up at some point. So structure these conversations where both of you are in a state of mind to talk, but have these conversations. And if you cannot do it right now, at least say that this is not the right time for me, but yes, I will take this up at some point in the future. And setting boundaries with family members is very important because everyone is going to give you advice on how to deal with it. If the husband's mood is off, the wife's mood is off, this is what you do. No, don't involve more people in it. It is a couple issue. That's what we've been saying throughout. It's a couple issue. Friends and family may be well meaning, but this is a couple issue. It should be resolved between the partners.
Absolutely right. And Dr. Akshata, there is one more very serious issue that we very often come across with the couples is the stress of the infertility treatment is there. In addition, many times there are challenges in their sexual function. There are a lot of sexual challenges that these couples face because of infertility. Means many times we get a call early morning, husband calling, doctor, we could not keep relations yesterday night. The ovulation has occurred, and this had never happened before. But I don't know why this happened. So these type of situations come up, and then that adds to the stress of the couple.
Yes.
So regarding this, what can you tell us about managing this stress or which affects their even sexual function?
So one of the things is that during the treatment, they will be asked to have intercourse on certain days, or we will be asked to avoid intercourse on certain days. Now, the thing is here you have to also account individual desire, interest at that moment, whether they want to or not, or they may want to on other days. So on days that they may not get to, it may lead to some frustration that I'm not able to get the sexual satisfaction. And on the days that they are expected to perform, there is already a lot of pressure कि there is बच्चा नहीं हो रहा है, उसके ऊपर यही time पे यही date पे करना है because it's around the ovulation time. So For a lot of people, it can put a lot of pressure on it. So in this case, it is important for the partner to be empathetic. It can happen both to men and women. It is not confined to any one gender. It can happen to either person. So it is important for the partner to be understanding and empathetic. You're not a machine, first thing. You're not going to be able to perform in a certain situation just because you are told. Abhi, if it is like, anything else, if it is some sort of machine, we can program it and say, okay, this day at this time, you're supposed to do this function. You're a human person. When we talk about biology, it's not just as simple as mechanics of any machine or anything like that. There's a lot more that goes into it. And specifically taking emotions into account, taking mood into account, we have to be more empathetic towards each other in these situations. If one of them doesn't feel up to it, that's fine. We can try the next time around. Have that ability to hold space for what your partner can and cannot do in that situation. Be empathetic, be understanding, and most importantly, be patient with each other.
Yeah, Dr. Akshita, I would really like an important advice to the viewers from you. Is there are a lot of people who do watch porn, but we have seen it affecting their intimacy or their sexual relationships. So I would definitely like you to give them advice regarding that and how can they apply it to their lives.
And especially patients, couples with infertility.
Yeah.
If this happens in that situation, then it worsens the problem. So, can you share some your thoughts about this?
So this is a common query that comes up even otherwise, like outside of infertility, it's a very common thing that patients will probably come and ask you as well that, when we watch movies or we watch porn, you see that, this person is able to perform for so long, sometimes with multiple partners and in different positions and things like that. Now here you need to first break the illusion, break the bubble, tell your patient that this is a movie. It has been shot over a period of time with a lot of breaks, with a lot of massive amount of editing. It is not that everything is done in that one stretch. And they are actors, they are doing a job over there. A lot of it is also fabricated. There are tricks. Obviously, everybody knows that there are tricks that people use, camera angles and things like that, to make things look different, to make things look bigger, stuff like that. So break the illusion for them. Tell them, for example, I get a lot of people also seeing that they will see something on reels on Instagram or anything and then ask you about it, and you have to explain that this is content that is created. It is not necessary that it is accurate. It is just content that is created. It is the same as watching a series or watching TV. It's content that has been created specifically for a set of audiences, and you have to understand that there's a process that goes behind it. This is not an accurate depiction of what real life is. So, for example, with porn, showing that this person has multiple partners and this is how they respond to things, it's very unrealistic because it's a fantasy. It's basically a fantasy that's coming out, right? So, you have to explain that to people that this is not real and be realistic as a person of a certain age, of a certain build. There are very specific things that you are going to be able to do. So here, I think the role of the gynecologist is also very important because you can explain to them that, what is real and what is shown as part of something they're trying to sell. That is very important. So break the bubble. That's the first thing I will always say here.
That was a very, very important advice to the viewers also, because we do have people who do question, and especially like Dr. Raut said that for infertility.
And so then they feel that because we are not performing, say, X number of times or 3 times in a day,
the way it was shown in the film.
Therefore, so they get these wrong notions and they start blaming each other. The communication deteriorates and the problems worsen, and this adds to the medical problem. So that's why we wanted your opinion about this issue.
So the problem with porn is that it gives a lot of unrealistic expectations about everything. So first you have to always educate people that this is manufactured content. This is not reality. This has been created. It has been tailored for a specific audience. This is why it is like this. And there's a lot of work that goes behind the scenes. For example, when you watch Jurassic Park, You know that there are animatronics and there's CGI and there's green screen and whatnot. It's all special effects. It's the same here. There's a lot of work that's happening behind the scenes. There's a lot of special effects that's being used. This is not what reality is.
Thank you for that. The next thing that we always feel is the infertility couples face so many challenges emotionally. So, and they try to get over it. Sometimes they succeed, sometimes they can't. But what the effect of all this is there on their relationship. So, the infertility becomes the main part of their life, and their relationship takes backseat, and this further affects their problem. So, can you throw more light how they can focus more on their relationship in along with infertility, so that their life becomes more easy, and it also helps them to tide over the crisis of infertility?
So what Sir said is absolutely right, that when infertility comes into the picture, it becomes the biggest part of the relationship and everything else takes a backseat. Now, the thing here is because it is becoming an issue that everybody is asking about, everybody is talking about. Wherever they go, people will ask them, good news kab milega. In their head, they are also wondering, when will this work out for me? So this is something that becomes all you're thinking of. Now, the problem with that is you're ignoring that there are other aspects to your relationship as well. Having children, having a family is a big part of it. I'm not going to say that don't think about it, leave it aside, focus on your career. No, that's very insensitive. I will not say that. But I will say that there are other things also that are equally important. And in any situation, when one thing gets the most attention or gets the most amount of negative attention, in this case, everything else fades into the background. So the couple may not realize that outside of this, we actually have a good, healthy relationship. We were actually very happy and together before all of these struggles came up. They may forget to appreciate how kind, how nice, how generous the other person is, because the focus is on bacha nahi ho raha hai. They may not be able to appreciate the partner, their family, all the good things, because the focus is only on this is not happening. And human nature kaisa hai? The more we focus on something negative, we forget all the other good things. You could be having one thing that doesn't go well in your day and everything else is going fine. But human nature kaisa hai? Arey, ye nahi theek se nahi hua, ye theek se nahi hua. You're not thinking about the other 99 things here. Now the problem is when we develop this, like the horse with the blinds, we develop this mindset that this is all there is. Everything else gets ignored around us. And that means that they will not spend time with each other. They will not continue to show appreciation for each other. Any relationship, if you want it to succeed, it has to be worked on. It's not a spontaneous process and it doesn't happen by itself. It has to be actively worked on. You actively have to make an effort to make your partner feel special, to make them feel appreciated. And those things go into the background because the focus is only on this. So, what I would say is, please find time to spend with each other outside of the bedroom as well. Do things that you like doing together. Go for movies or go for outings. Spend time with each other. Spend time communicating. If you have an option to travel, then do that. Like, do something that is outside of fertility related stuff also. Don't let that become the only focus.
So, Dr. Akshata, now, uh, as you had discussed, that this is a marathon journey for infertility. And whenever a person wants to run a marathon, they are going to take training from a profession. So, along this journey of infertility, where do you think a couple should start taking professional help?
Because they may use mindfulness, meditation, they may have now nice communication, but still that may not be enough.
There are going to be challenges, different emotions which come up with it.
So when should they take an expert's opinion to tide over their crisis?
तो कॉमन टेंडेंसी क्या है कि जब प्रॉब्लम है तब हम सोल्यूशन ढूंढेंगे. दैट इज हाउ वी ऑल टेंड टू थिंक दैट इफ थिंग्स आर गोइंग वेल वी विल नॉट रॉक द बोट, लेट अस प्रोसीड द वे थिंग्स आर, which is fine. In this situation, I would say, if you have the resources, if you have a good doctor, if you have somebody that you can talk to, start taking help early on as a preventive. In this case, you are working in a way that is from a preventive mode. You are trying to ensure that these things will not crop up later, or if they crop up, you will be prepared. Factually speaking, वो crop up होने वाला है, but you will be more equipped to deal with it. So think of it more as a preventive. It has to be a journey together. It is not that this is one part, this is one part. If it goes together, definitely it will go further on. For a lot of people, I think generally kaisa hai, crisis hone tak they will not go to someone, to a counselor or a psychiatrist. Unless there's a crisis, people will generally not visit. But I would say that it would be a healthy thing in terms of infertility to get an idea of where you are right now, what you can expect, and a lot of these questions will definitely be answered by a gynecologist. But some of the more emotional or the personal ones can definitely be taken up by a therapist. So rather than waiting for, the first problem to arise, maybe you could start off with taking sessions regularly and seeing how you both are doing with this, more from a preventive slash curative point of view.
Yeah, and I think now it's high time that couples realize and even families realize that it's not a taboo to take professional help. And it's always better than resorting to alcohol, smoking, or substance abuse. It's always better in such a situation where the emotional roller coaster is huge. So it's better to seek professional help than to resorting to substances which are going to harm your health.
Absolutely right, Dr. Mugdha.
Absolutely.
One more thing I would like to tell here is, yes, the couples, if they feel the need, they will definitely take help of mental health expert. And as you, Dr. Akshata, said, even gynecologists do some part, can play some part in it. But I feel gynecologists can take one more step ahead. And if they feel, and they notice that this problem is really severe, mental health problem, then they also can recommend that the patient to take help of a mental health professional, a psychiatrist, because coming from an expert of our gynecologist to take help of another expert is definitely going to help the patient, or rather patient is more likely to follow that advice rather than someone from family telling or someone they decide on their own. What do you think?
So I've had this amazing experience with a lot of the doctors that I work with, the non-psychiatrists I'm saying, where they have asked their patients for a number of reasons to talk to a psychiatrist. And they've said it in such a non-stigmatizing way that when the patient comes to you, they are happy to come to you. They're coming to you of their own free will. And they are like, oh, Dr. So-and-so has sent me. And he or she said that, I should talk to you about this. And I'm so happy because the patient has come with a very open mind, They don't feel that coming to the doctor or to a psychiatrist is a punishment. They don't feel like I have done something wrong or I'm, mental. The most common word we colloquially use in Bombay is mental hai kya. So that kind of attitude is not there, because when physicians, surgeons, gynacs, if all of you are doing the job of removing the stigma, because a lot of them will come to you first and then to us, It's amazing because the patient comes with this attitude that I'm coming to you and I need help and please help me out. This is what my doctor recommended. They will have a lot of faith in you because you are their primary physician. You're the primary person who's taking care of their medical and surgical treatment. So they have a lot of faith in you. So I'm just so happy when doctors are open-minded about this, which is a great attitude in the last few years, which I've noticed. And it gives a lot of support for the patient because emotionally they feel like my doctor has recommended it. He or she must be absolutely right in this, So they come with that confidence that, yeah, I think it'll work out for me, rather than feeling stigmatized that I have to go to a psychiatrist. So I think even other specialty doctors can do a lot to reduce the stigma. I've also unfortunately had a few unpleasant experiences where patients who required medication and who required treatment went back to their own doctors or surgeons, and then they were told, why are you taking this? You'll become an addict, like don't take this medication or don't go for this. This is not necessary. And most of them were very serious cases. They were not something that could be managed conservatively. They had to be on medication. So I'm just saying this, having this kind of understanding between different specialities is very, very important to reduce the stigma of something like this. Because when you all say it, it has a lot of weightage because you are their primary doctor, so they will look up to you and they will take your opinion into consideration very seriously. So the way you say it that, yes, I think you should just talk to somebody and get a few things cleared. It helps a lot, definitely.
So, do you recommend any exercises or any specific practices which a couple should undergo? Like there could be journaling, there could be other things which they can do as a couple to be able to strengthen their relationship in this infertility journey.
So journaling, I think, is a great idea for people who can do it. Again, see, with every technique doesn't work for everybody. Okay. For some people, some things work very well. So coming to journaling, I think that's a great idea for them to do together or individually. Generally, journaling, a lot of people would prefer to keep it private. They may not want to share. But if this is a couple effort, maybe they would want to write a few things together and discuss it with their therapist or keep it private for themselves. So journaling, I think, is a great idea. Even taking out time to do a little bit of, breath work or some mindfulness exercises like mindful eating, spending the end of the day together just to talk for a few minutes, about what your day has been like, to talk about things outside of infertility, to talk about things which are not related to the medical and surgical stuff they're going through, just to generally talk about things, even spending time watching a show together. Something very simple. Like what I'm trying to say is, it has to be something we can do consistently. It's something you can do on a daily basis. Sitting together to watch a show is very simple. I mean, it's very doable. Find something that you both like and do that together. It's a great bonding experience. On a slightly unrelated note, I remember one of my patients telling me that she's had a difficult relationship with her mother since she was a child, and now she's in her 20s. And she mentioned that during the lockdown, they both started watching Korean dramas together. Korean dramas are very popular right now. And they got hooked onto it. And that became a talking point for them because first they would start talking about the Korean dramas and then they would start talking about actual things that were happening, conversations that have not happened for years. So I'm just saying it can work as an icebreaker because instead of dealing with the conflict, you're communicating about other things as well, which will gradually lead to the conflict getting resolved. That is another way of looking at it.
That's great. I think, Dr. Akshata, today's topic of communication, I think you have dealt all the aspects related to communication or communication problems which are faced in infertility and how they can be resolved. And there are different ways and when they can take expert help in these situations. I think this will go a long way in helping a lot of couples who have been facing, not only facing infertility, I feel any couple, I would say, with the other problems also, we will learn a lot from what you have told today. So maybe to end, can you give a very brief message, or you can say to these couples who are struggling with infertility with communication problems? So what brief 2-3 lines, if you would like to say what they should do or what they can follow.
So to recap, first thing, have the difficult conversations early on. Okay. Second thing, when you want to have a difficult conversation, see that your partner also has the bandwidth to have that conversation. Naito, take it up at a later point. Don't avoid it altogether. Third thing, remember it's a couple issue. It's a couple issue. It's not a family. It's not a single person. It's a couple issue. So you have to address it accordingly. Four, show up for your partner in other ways, in all ways possible, whether it's going to the doctor, whether it is going to family functions with them. Showing up for somebody really makes a big difference. Be there, be supportive. And lastly, when you feel that things are getting difficult, either of you cannot cope or things are getting complicated, don't be afraid to take professional help. There is nothing wrong in taking professional help. It doesn't make you a weak person. You're just going to the right person to deal with this instead of struggling and struggling and struggling to take things further. So take professional help when required.
So thank you again, Dr. Akshata, for this wonderful, I think again an insightful episode. And to all the viewers, do like and share and subscribe to our channel. And definitely share this episode to at least one person. Because again, knowingly or unknowingly, you may help one couple complete the family of their dreams. Thank you for watching and stay tuned.